Hello everyone, my name is Cordelia Padua. Today I will present my health communication campaign on management of depression in older adults with dementia. The reason why I chose this topic is because this is the topic that I will be working on for my clinical scholarly project or my CSP. Depression and Dementia Overview. Depression is very common among people with dementia, especially during the early and middle stages of diagnosis. Experts estimate nearly 40% of individuals with dementia will suffer from significant depression. Individuals with dementia may have a hard time expressing their sadness, hopelessness, which is why they are underdiagnosed, and this will further exacerbate depressive symptoms. There are many warning signs of depression in dementia patients. Feelings of sadness and unhappiness lasting mostly one day, decline in interest or pleasure in almost all activity, changes in sleep patterns or appetite, experiencing frequent thoughts of death, dying, or suicide, feelings of fatigue, tiredness, and loss of energy almost every day, irritability, restlessness, or having trouble staying still, loss of interest in pleasurable activities. Risk factors. The likely biological linkage of depression to dementia include vascular disease, alteration in inflammatory changes of the brain, and deficit of nerve growth factors. Depression has been both proposed to be a risk factor for dementia as well as symptoms. In general, older women are at greater risk of depression because women are twice as likely as men to become seriously depressed. Biological factors like hormonal changes may make um, older women more vulnerable to depression. My education piece and key facts. Depression causes physical symptoms. It affects much more than moods. It causes increased aches and pains, decreased appetite, causes insomnia, lack of deep sleep, or oversleeping. Depression causes overall physical, mental, and emotional debility. The next slide will introduce my brochure, flyer, posters for depression in depressive adults. Goals and treatment of depression. Depression is usually a treatable and recurrent disease which is often underdiagnosed and untreated in older population. Treatment is available and can make a significant difference in quality of life. Usually, more positive patient outcomes are associated with early diagnosis and treatment. Non-pharmacological and pharmacological strategies are both important in treating depression in dementia, and management of patients requires a collaborative effort. Non-pharmacological method should be first line of intervention in treatment of depression in patients with dementia. Intervention targeting the patient as well as the caregiver are also important. Intervention may range from arranging a daycare for patients to participate in activities, to educating caregivers on different caregiving skills. Once a non-pharmacological intervention has been established and the patient suffers from severe depression, pharmacological intervention is also warranted. A selective serotonin reuptake inhibitors or the SSRIs such as Celexa, Lexapro, Prozac, Paxil, and Zoloft are generally recommended due to their relatively benign side effect profile. And lastly, my references. And thank you for your time. Goodbye.